Okay, good afternoon, fellow Earthlings. Some anonymous asked me to show how to draw up and inject a testosterone shot, being that I'm a nurse and I draw up medicines every single day of my life, and I've done that for about the last 7 years. And so I literally can do it with my eyes closed. Like literally I have done it with my eyes closed because like I've done it with a migraine, so like I can do it by feel. Um, and so this is how you do it. Keep in mind that most of you are probably injecting in the ass or the thigh, which is because you generally inject large volumes. By large volumes, I mean 1 milliliter or 1 cc, or 0.5 milliliters or 0.5 cc's. Those are typical doses. You guys generally probably inject every other week, and that's kind of a standard dose. Me, I inject a very small amount. I inject actually 0.1 cc, and I inject every week. And because I inject such a small dose, I inject in the deltoid up here, in the same spot that you would get a flu shot for. So I inject in a smaller muscle group, and this muscle group can hold up to 0.5 cc's. But the process is all the same, and I actually can go over and show you the injection locations for injection in each of the sites. I'm just not going to inject myself in my ass or in my thigh. I'm going to go ahead and inject myself in my arm where I usually do. So the important thing to remember is you are putting something that is sterile into a location that is sterile, meaning you're breaking the sterile boundary of your skin, which your skin is not sterile, but the inside of your body, hopefully, unless you're infected, you have a cold or something, the inside of your body is sterile. Your needles, your alcohol, all of this is sterile. If you do something like using your dirty hands and touching all over the top of your vial without cleaning it, or touching the needle without cleaning it, then you're breaking that sterile boundary, and then you're injecting bacteria straight into your body. So that would be one of the reasons why you might get a big red lump, because you're injecting bacteria into your arm along with testosterone, or into your thigh along with testosterone. I mean, there can be other reasons. You might have an allergic reaction. You might have injected in a way that irritated yourself. So these are a couple of things to remember. Always clean with alcohol the top of the vial and your skin before you inject. Okay? When you clean your skin before you inject, let it dry about 10 seconds or so until your skin isn't glistening anymore, because if your skin is still glistening, then you've got rubbing alcohol. Have you ever poured rubbing alcohol in an open cut, or used hand sanitizer when you had a hangnail? It burns like a bitch. Well, if you inject through glistening rubbing alcohol, then it's going to burn like a bitch. So that might be one of the reasons you guys are experiencing burn when you inject. If you let it dry on your skin is still sterile or clean of all the bacteria, and it will be less likely to burn. Some formulations of testosterone, they burn anyway, and so there's no help for that. Another thing to remember, an intramuscular shot needs to be given at a right angle. So that means if this is the surface of the muscle and this is your needle, you don't want to give it like this. You don't want to give it like this. You definitely don't want to give it like this. You want to give it straight down like this. Okay? And the faster you give it, don't hesitate, don't cringe, just go like this. Okay? And the reason I've got the cap on, so I'm not going to poke myself. That's how I give it at work. Unfortunately, I can't do that to myself. So if you can give it fast, it will be less painful. If you have to give it slowly, it's going to hurt a lot more, because you're going to feel every little change when you pass through the skin, and then you pass through the subcutaneous fat, and then you pass into the muscle. You're going to be able to feel all those different layers change as the needle passes through each of those tissues. And so it's going to be a lot more uncomfortable for you. So if you can dart it in, just stab yourself. I mean, literally, just poke it straight down. The next thing you want to make sure you do, once you've poked yourself, is you have to aspirate. That means pulling back on the plunger until you see a tiny little air bubble come up. Okay? The reason you're doing this is you're making sure that you have not accidentally hit a vein. There are tiny little vessels all throughout your body underneath the skin. You can't tell where they are. I can't predict for you where they are because they're literally everywhere. And it's it's not like you're injecting, in your elbow right here where there's definitely one. So, odds are good that you haven't hit one, but you want to make sure that you haven't. So you pull back on the plunger once it's in your body, just like this. Can you see that? And try and do it as best you can without doing this, because if you do this, do you see what my needle is doing? Well, all of that needle underneath the skin, that's wiggling around inside the muscle. So try and do it and keep it still. If you see blood in the chamber, then that means you have to poke yourself again, because you can't inject that needle. You can't inject if you get blood in your needle, because you would be injecting straight into a blood vessel, and you don't want the testosterone to go straight into the blood vessel. The reason you're injecting into muscle is because it slowly absorbs like an extended release time capsule. And if you inject straight into the blood vessel, then it goes right into the bloodstream, then it goes right into the liver, then the liver works to destroy it. If you inject into the muscle, then it slowly releases. It gets into all the body tissues, and then slowly the liver destroys it, which is what its function is. The liver changes it into other things the same way a guy does. A guy releases testosterone, the testosterone gets changed into other things by the liver, and that's how the testosterone works in your body. As a guy who produces testosterone not naturally. Sorry. Please forgive me for not clarifying. When I said guy, I meant cis guy, and not a guy who needs to supplement testosterone. So, I've been explaining things for about 9 minutes now. Let's just get right to it. The things you need one big-ass needle. Your doctor has probably prescribed you approximately an 18-gauge needle to draw up the testosterone. You should not be using the same needle to draw up the testosterone as you are to be injecting. The reason for this is testosterone is really thick. If you're using the same needle to penetrate the top of the vial as you are to inject, then you're using a dull needle to inject. Talk to your doctor about this if you're using the same needle, because he'll prescribe you different needles. You also should be using a tiny needle, probably about a 23 gauge or a 22 gauge. This one is much smaller, a lot closer to the size of what diabetics use to inject. It's thicker than that, but it's closer to the size. This one is about the size of what people use for like piercings. You should have your testosterone. You may or may not have an additional needle to draw up in. I do, because I use a 1 cc needle. My other needles come in a 3 cc needle. They just happen to come together all attached on one. So what I have to do is I have to take the prepackaged, it comes like this, 3 cc needle, and put it on the 1 cc needle. The reason for that is it has a lot more clear markings on it. See how it says 0.1, 0.2, because my dose is right there. If I were using the other needle, my dose would be right there. Do you see how much more precise it is that I'm using this needle? Keep in mind, you see the pink part here? That's called the hub. The hub is a reservoir in and of itself. It can hold about 0.005 mils of testosterone. Now, for you guys that are on like a 1 cc dose, that's not a whole lot. That's pretty much negligible. But if you guys are on like a 0.5 or a 0.25, or like me, a 0.1 milliliter dose, you'll hear me switch between cc's and milliliters. Those are the exact same thing. Don't get confused. They're the exact same thing. If you guys are on small doses like that, 0.1, 0.2, 0.25, you need to draw up an air bubble with it so that you're getting a very precise dose, because that 0.005 of a dose that's hiding inside of that hub, that's going to affect your dose. That's going to give you an extra dose. If I were to draw up and fill that hub too, that would double my dose. Okay? You want your rubbing alcohol, and you may want a gauze pad just in case of the bleeding, or a Band-Aid. I don't ever use Band-Aids because I'm allergic to the adhesive on Band-Aids and also medical tape, and so it's all irrelevant for me. So here's your testosterone. You see it there, nice and kind of yellowy? You take the testosterone. Here, I'm trying to put it in a way that you can see everything I'm doing. And you swab the top with the rubbing alcohol. You take the large gauge needle and you put it through the top. The reason I'm being extra careful in doing this is because I'm allergic to latex as well, and so I try and puncture in the same spot every time. It makes it less likely that tiny latex particles will go into my testosterone, because this is about a 6-month supply for me. This is I'm on such a small dose. And I don't want to contaminate this and risk the fact that I'm going to have an allergic reaction just because of the stopper. You're going to turn your vial upside down, and can you see the needle in there? You want to make sure the needle is floating in the testosterone and not sticking out of the testosterone, like if you had it tipped and you see the needle is out of the testosterone now. I think it is. I can't see because it's on the back side for me. But if you have it straight up and down, you want the needle out of the into the testosterone, so it's floating in the air. Then you pull back to your prescribed dose, and I have to turn it around now so I can see my prescribed dose. If you're on a tiny dose, you want to push again forward to a little bit less than your prescribed dose, about 0.05 less than your prescribed dose, to make sure that you make room for all that's getting into the hub. Does that make sense? And then you're going to draw up, turn your vial sideways so that the needle is floating in the air. Okay? Can you see that? Just put your needle into the air bubble and then draw up an air bubble. This is not going to kill you. This is not going to hurt you. If you're not sure how to do that, just turn it upside down and then draw back an air bubble. The reason it's safe to draw an air bubble is because you're going to check and make sure that you're not in a vein. So you're going to put the air bubble into the muscle. The muscle doesn't care if there's an air bubble in it. It's not its business. It doesn't mind. The air bubble will eventually become absorbed by the body, and it's not going to be any problem. The other advantage to putting an air bubble is you won't have testosterone leaking out of your arm. Sometimes that's a problem for guys, is the testosterone leaking. So now you have some testosterone and an air bubble, and you're going to make sure that it's the right dose, and that is my right dose. So flick your needle to make sure that all the testosterone is out of the hub. To change needles, very carefully recap so you don't stab yourself, and then get the new needle. Remember how we were talking about sterility? Now is very important. So carefully open up this small needle. Don't touch this part. Just screw it on like that. Then turn it upside down so that the air bubble is last. You want the air bubble closest to the plunger. Do you see that? I've got testosterone here and then air bubble here. Okay? To find the site that you want to inject for the deltoid is shaped like a V. It comes down like this and then up like this again. So you can inject anywhere in this spot right here, right in the middle of the V. If you've got well-developed muscles, then that helps because you can actually see the deltoid. You can kind of see mine, but I've got really bright lights on, so you can't much see shadow. But if you see I flex, you can kind of see it. There you go. You can see my dent right there. So I'm going to inject right about here. So clean the area. Clean it really well. I'm just fanning it off to get all the rubbing alcohol off. Now, do you see the difference in size of this needle versus that needle? It's much smaller. It's going to be much less painful. So, then remember, right angle, straight in. Sorry, my hand is blocking everything. There you go. Now, pull back on the plunger. Can you see me pulling back? And I can vouch for myself that there's no blood in there. And then you inject the testosterone. And then the air bubble. And that's it. And I usually don't bleed much. For the other sites, I'm going to cap this. And then you want to put your sharps in a sharps container. You can use all sorts of sharps containers. I use a large medicine jar. I've seen people use like washing detergent bottles and things like that. You can use all sorts of things. Just make sure that when it gets full, you take it into the pharmacist and have them destroy it. Don't put it in your regular trash. That's illegal. You can also take it into a doctor's office. They'll usually destroy them for you too. Injection sites. Other injection sites are as follows. I'm going to see if I can do this without turning off my webcam. Okay, your thigh here. Your thigh, you want to inject not here and not here. If you make a muscle, you can feel this good strong muscle here. You can inject anywhere on the upper outer third. So you can inject here, 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 or here. You want to make sure that you're alternating sites, this leg and then this leg, back and forth. Don't use the same thigh every time. And then back side. If you draw an imaginary line from here, which is like, oh, how do I describe this? I can't describe it without using medical terms. I cannot describe for you how to inject in the butt. I'm very sorry. You're going to have to talk to your doctor on that one if you are to be injecting in the butt. I really don't recommend that location. There's a lot of nerves back there, and if you do strike that nerve, you can end up with permanent nerve damage. It's called sciatica. I was born with a genetic form of that, and it is incredibly painful. So do talk to your doctor if they recommend injecting there. Talk to them and ask them if they feel like it would be safe for you to inject in your thigh. It is really recommended against in the medical community to inject in the ass anyway. Talk to them and find out if they would be okay with you injecting in the thigh. It's much safer, especially for a non-medical professional, to inject in the thigh versus injecting in the butt. Talk to your doctor if they're asking you to inject in the backside. I hope this has been helpful. I hope it hasn't been too long, and I hope I didn't bore you. There you go.